Welcome to our presentation today. Do you know where the drugs are going? Drug diversion is not a new problem in the medical community. In fact, the drugs most frequently diverted and the percentage of people using psychotherapeutic drugs, pain relievers, tranquilizers, stimulants, and sedatives has changed very little since 2002. Since drug diversion is not a new problem, why does it deserve our attention? Drug diversion may lead to added cost to the healthcare system through increased emergency department visits from adverse effects and overdoses, prescribing of unnecessary medications, and fraudulent activities. Media headlines in the last few years have shed light on the problems of prescription drug abuse. Stories have included pill mills being shut down, prescriber identity theft, celebrity admissions to rehabilitation facilities, and deaths from prescription drug overdoses. According to the Centers for Disease Control and Prevention, the CDC, approximately 16,600 people die each year from prescription painkiller overdoses. Several states have implemented prescription drug monitoring programs, PDMPs, to track the prescribing and dispensing of controlled substances. These programs are discussed in more detail later in our presentation. By the end of this presentation, you should be able to identify common types of drug diversion activities, list the drug classes that are typically targeted for drug diversion, recognize the common behaviors associated with drug diversion within the pharmacy environment, and list actions that can be used to prevent drug diversion activities. There are several questions that you should be able to answer by the end of the presentation. The first question is, common types of drug diversion activities include which of the following? A. Theft. B. Illicit prescribing. C. Card sharing. D. Counterfeit distribution. Or E. All of the above. The second question is, which of the following is not a drug class frequently targeted for drug diversion? A. Stimulants. B. Human growth hormone. C. Narcotics and opioids. D. Antibiotics. Or E. Central nervous system, CNS depressants. Katie has been a patient at your pharmacy for several years. She has always been very patient and courteous. You've noticed a change in her behavior over the past month or so. She's been very impatient and demanding with your staff. On the last 2 visits, she looked like she just crawled out of bed. Today, she brought in a prescription for OxyContin that is missing the date. Your pharmacy technician informs her that you'll need to contact the doctor to find out when he wrote the prescription. She immediately replies that he wrote it today and you do not need to waste your time. What do you do? What would you do? A. Call the doctor to verify the date. B. Take the patient's word for it and fill the prescription. C. Notify the doctor of the patient's odd behavior. D. Reprimand the technician because there's no need to verify the date. Or E. Both A and C. And finally, which of the following is not a strategy to prevent drug diversion? A. Use the prescription drug monitoring program. B. Develop a comprehensive training program. C. Refer patients to prescription drug disposal program. D. Dispense medications from prescriptions with missing provider information. Or E. None of the above. Before we focus solely on the topic of drug diversion, it is important to understand how it fits into the bigger picture. Drug diversion falls under the umbrella of fraud and abuse. Fraud is defined in the law regulating the Medicaid program as an intentional deception or misrepresentation made by a person with the knowledge that the deception could result in some unauthorized benefit to himself or some other person. In other words, fraud occurs when false claims are submitted and medications are unnecessarily dispensed. According to Medicaid, abuse by providers is considered to be practices that are inconsistent with sound fiscal business or medical practices. These practices result in an unnecessary cost to the Medicaid program or in reimbursement for services that are not medically necessary or that fail to meet professionally recognized standards for health care. This definition also includes beneficiary practices that result in unnecessary costs to the Medicaid program. The Chief Counsel for the U.S. Department of Health and Human Services Office of Inspector General OIG, testified before the U.S. House of Representatives Committee on Ways and Means in 2010 and stated that healthcare fraud, waste, and abuse are serious problems. And while the majority of healthcare providers are honest and well-intentioned, a minority of dishonest providers can cost taxpayers billions of dollars. Fraud and abuse in the healthcare system frequently occur as a result of inappropriate billing, sharing identification cards, doctor shopping, and diverting prescription drugs. Examples of fraud associated with pharmacy billing include billing for a brand name medication when a generic medication was dispensed, billing for an incorrect national drug code, billing for the entire prescription quantity when only a partial quantity was dispensed, and returning a prescription to stock without reversing the prescription claim. Card sharing occurs when a beneficiary shares or loans his or her ID card for medical or prescription drug coverage to a person who is not covered by a third-party payer to receive services in the beneficiary's name. In fiscal years 2006 and 2007, doctor shopping resulted in about $63 million in Medicaid payments related to prescription drugs. This amount does not include the cost of the office visit. Pharmacies are the last stop before the drugs reach the patient. Therefore, pharmacists are the last line of prevention. Other types of fraud that may be seen in the pharmacy include unauthorized substitution of a generic medication, dispensing counterfeit medications, price manipulation, and drug diversion. Today, we're going to focus on the detection and prevention of drug diversion. What is drug diversion? Drug diversion is simply the deflection of prescription drugs from medical sources into the illegal market. Drug diversion also includes the use of prescription drugs for illegal or non-medical purposes. Drug diversion may occur at any point in the distribution process of prescription drugs, from the manufacturer to wholesale distributors to pharmacies and ultimately the patient pursuant to a provider's prescription. Drug diversion can lead to significant health, legal, and financial consequences. Health consequences include overdose, unnecessary emergency department visits, and even death. The CDC has identified drug overdoses, including those from prescription drugs, as the leading cause of death from unintentional injuries in the United States. In 2007, the Drug Abuse Warning Network reported that nearly 31% of drug-related emergency department visits involved the non-medical use of pharmaceuticals, and, according to the National Highway Traffic Safety Administration, of the fatally injured drivers in 2009, 18% tested positive for drug involvement. Attempting to obtain a controlled substance by misrepresentation, fraud, forgery, or deception is a felony in most states and is punishable by prison terms or fines. Other legal, financial, and social consequences may occur as a result of being under the influence of an illegally obtained prescription drug. Providers involved in drug diversion activities are at risk for suspension or loss of license, exclusion from participation in Medicaid and other federal health care programs, restitution, recoupment, imprisonment, and civil monetary penalties. Drug diversion also has financial implications that are separate from the fines that may be imposed for participating in illegal activities. Drug diversion contributed to a four-fold increase in substance abuse treatment admissions from 1998 to 2008 for individuals ages 12 and over. Before we discuss the drugs that are being diverted, it is important to understand why people divert drugs, specifically prescription drugs. Prescription drug abuse occurs when patients take a prescription medication that is not prescribed for them, or when patients take the medication for reasons or dosages other than what was prescribed. They may take these medications for recreational purposes or because they have become addicted. Patients may not realize that prescription drugs can be just as dangerous as illegal drugs. Patients may choose to self-medicate by increasing their medication dose without the knowledge of their physician or pharmacist. They may also borrow medication from a friend or family member to treat a self-diagnosed problem. Many prescription drugs that are diverted are controlled substances. Patients who have taken controlled substances for prolonged periods of time can become dependent on the medication and may continue to take them to prevent or treat withdrawal symptoms. The good intentions of patients trying to stop abusing prescription drugs can sometimes cause them to restart, because they are unable to manage the withdrawal symptoms. Prescription drug diversion can also be a lucrative business. Some medications can sell for 10 times the retail value on the street. The most commonly abused prescription drugs, as identified by the National Institutes of Health, are central nervous system, CNS depressants, opioids, and stimulants. The CNS depressants include pentobarbital, methylbarbital, benzodiazepines, and hypnotics. These medications produce a drowsy or calming effect, but can be dangerous when mixed with alcohol or other medications. Narcotics and opioids include buprenorphine, fentanyl, hydrocodone, hydromorphone, meperidine, methadone, nalbuphine, oxycodone, and tramadol. These medications can induce euphoria by increasing dopamine levels in the brain. The feeling can be intensified if the drugs are snorted or injected. However, these unintended routes of administration also increase the risk of respiratory depression, coma, and addiction. Stimulants, such as methamphetamine, methylphenidate, amphetamine, and all of their derivatives, produce effects similar to caffeine but are more potent. Methylphenidate is similar to cocaine in that it binds to similar molecular targets in the brain and increases dopamine in reward circuits. If the drug is administered by intravenous therapy, the rapid and large increase in dopamine causes a rush or a high. Not all people who abuse stimulants use them for their euphoric effects. Students who abuse stimulants often do so to improve cognitive function. Other prescription drugs identified as being of concern for abuse are anabolic steroids, anesthetics, antitussives, human growth hormone, and skeletal muscle relaxants. Dextromethorphan is also found in many over-the-counter OTC medications. At high doses, dextromethorphan can act like PCP or ketamine, producing dissociative or out-of-body experiences. Drugs can be diverted in many ways and through a variety of people, including patients, pharmacists, pharmacy personnel, physicians, other prescribers, nurses, and other healthcare professionals, as well as suppliers and even through illegal internet pharmacies. Illegal internet pharmacies are rogue websites that operate under the guise of legitimate pharmacies and may provide controlled substances or other medications to individuals without a prescription. These pharmacies evade state licensing requirements and standards by operating across state and international borders. The U.S. Drug Enforcement Administration, Office of Diversion Control, has an online reporting system for suspected unlawful sale of drugs. The reporting system is available by visiting the DEA Office of Diversion Control website. Patients can divert drugs in a variety of ways. Though it may seem innocent enough, sharing prescription medications with friends and family members is actually a form of drug diversion. It can be just as harmful as selling medications on the black market or stealing prescription pads to obtain drugs illegally. According to the 2010 National Survey on Drug Use and Health conducted by the U.S. Department of Health and Human Services, Substance Abuse and Mental Health Services Administration, SAMHSA, more than 50% of people ages 12 and older who are using prescription pain relievers receive the drugs from a friend or relative for free. As pharmacists well know, stealing or printing prescription pads in order to write fake prescriptions continues to be another commonly used method of drug diversion. Providers should take extra steps to secure prescription pads. As partners in the fight against fraud, waste, and abuse, pharmacists and providers can work together to reduce this source of drug diversion. We already discussed card sharing earlier in the presentation, but this is just a reminder that we all need to be aware that card sharing happens and to pay attention to the details in the event the patient slips and provides the wrong name or birth date when providing answers to our questions. Doctor shopping occurs when patients solicit multiple physicians or prescribers using false pretenses to receive a prescription. Pharmacists can help fight fraud, waste, and abuse by taking the time to contact prescribers who may be unaware that a patient is receiving the same or similar drugs from a different provider. Pharmacy shopping occurs when patients present forged prescriptions or prescriptions obtained by doctor shopping to multiple pharmacies. A pharmacist should be alert to the possibility of pharmacy shopping when patients filling controlled substances ask that the pharmacist forego billing through his or her usual insurance carrier. Forging and altering prescriptions are also ways that patients try to obtain prescription drugs. Patients may alter a prescription to obtain a larger supply of medication. Providers can minimize forgery by spelling out the quantity prescribed in addition to writing the number. Tamper-resistant prescription pads were implemented by the federal government in 2008, which may also minimize forgery by making it more difficult to print prescription pads and alter quantities. This topic will be talked about in more detail when we discuss provider identity theft. Drug theft can occur at any step of the supply chain. Robberies of manufacturers, distributors, and pharmacies can occur. Theft from friends, relatives, or healthcare professionals is also a danger. The DEA should be notified of all thefts or losses of controlled substances. An electronic form, Form 106, is available by visiting the DEA Office of Diversion Control website. Healthcare professionals may also be knowingly or unknowingly involved in drug diversion activities. Theft, diluting medications, submitting false claims, presenting false credentials, and illicitly prescribing medications are all ways that healthcare professionals may divert prescription drugs. Healthcare professionals often have access to controlled substances and other medications with street value. Theft may go undetected for prolonged periods of time, especially if the quantities are small and removed from stock infrequently. Diluting medications can happen in any healthcare setting, including clinics, hospitals, pharmacies, and long-term care facilities. The end result of diluting medications prior to administration or dispensing may be stealing or submitting false claims. Submitting false claims includes billing for more medication than was administered or dispensed, billing for medications not prescribed, and billing for the full quantity of medication when a partial quantity was dispensed. Prescribers may falsify credentials to obtain prescription drugs, prescribe large quantities of controlled substances for patients under the care of another provider, prescribe medications for fictitious patients with the intent of selling the drugs on the black market, or steal another provider's DEA number, national provider identifier, prescription pad, or electronic prescribing authentication. Prescribers may also initiate schemes that divert prescription drugs. A physician allegedly prescribed oxycodone to patients who then resold the drugs to third parties. In turn, those third parties distributed more than 11,000 oxycodone pills in a scheme resulting in a $1 million expense to the Medicaid program. Illicit prescribing occurs when patients are provided with unnecessary prescriptions or larger quantities of medication than are medically necessary. It may be difficult for pharmacists to detect suppliers diverting drugs. Suppliers can divert drugs in many ways, which can include distributing counterfeit or adulterated drugs, purchasing diluted, expired, or illegally imported drugs, and illegally obtaining discounted drugs and selling them to small wholesalers. How can pharmacists detect drug diversion activities? One of the strategies for detection is to be alert and watch for red flags. Is the patient picking up narcotics prescribed by multiple providers? Is the provider writing prescriptions for frequently abused medications for his or her own family members? Is the patient consistently requesting to pay cash for the prescription rather than submit it to insurance? Anything that sends up a red flag should be questioned. A phone call to verify a prescription does not harm anyone. It just takes time, and the extra effort to check into something that does not seem right may even save a life. Other strategies for detecting drug diversion are to recognize drug-seeking behavior, provider identity theft, and the signs and symptoms of drug abuse and withdrawal. These strategies will be discussed in more detail over the next few slides. Before we can prevent drug diversion, we need to know how to detect it. As pharmacists, we need to know how to recognize drug-seeking behavior and the signs and symptoms of substance abuse. When demonstrated in an individual, drug-seeking activity refers to a pattern of behavior characteristics of persons trying to obtain drugs through fraudulent means. Common drug-seeking behavior seen in individuals can be summarized using the attributes of a drug-seeking individual. Behavior. The individual may be demanding and indicate urgency, may be uninterested in a diagnosis, additional tests, or consultations, may exhibit mood disturbances or thought disorders, display changes in behavior, school attendance or work attendance, come in after regular hours or at the end of the day, or demonstrates threatening behavior or a lack of impulse control. The individual may claim to be from out of town or to have lost or forgotten a prescription. Avoids providing insurance and regular doctor information or sees multiple doctors. Exaggerates symptoms that have little objective evidence, or uses a child, elderly person, or sympathy to get pain medication or stimulants. Appearance. The individual may be underdressed or overdressed, may wear sunglasses indoors consistently, or may show visible signs of drug abuse, such as injection scars or skin tracks. Knowledge. The individual may have a large knowledge base about controlled substances, may request drugs such as methadone, morphine, hydrocodone, oxycodone, or fentanyl, may claim that non-narcotic analgesics are ineffective, or may appear to have or give a vague medical history. Drug-seeking individuals may also steal prescription pads or use someone else's identity. Identity theft can be that of a provider to forge a prescription or of a patient to use another person's insurance card. Provider identity theft is one of the major drivers of healthcare fraud in the country today. It can also facilitate drug diversion and other forms of fraud and abuse. A provider's identity can be stolen in a variety of ways. Although most requests by pharmacists are for legitimate reasons, prescribers tend to be cautious of requests to verify provider information by fax or telephone. The cost of provider identity theft includes lost revenue, the use of law enforcement resources, and, in the case of Medicaid or other government health programs, significant tax dollars. In 2009, 5 college-age individuals were arrested in California for illegally obtaining prescription drugs using stolen identities. Using DEA and medical license numbers stolen from a physician in San Diego, the ringleader ordered 5 blank prescription pads. Using these prescription pads, the group was able to obtain thousands of tablets of OxyContin, Xanax, Percocet, Adderall, and hydrocodone acetaminophen. One of the men was earning $31,000 a week by selling the illegally obtained drugs. This case reflects a common problem that all providers need to be aware of. Certain provider identifiers, such as NPIs, are readily accessible on the Internet. To help recognize provider identity theft, be aware of evidence of tampering on prescription pads and absence of required prescription information, especially when these signs are combined with a patient who exhibits drug-seeking behaviors. Pharmacists who are effective partners in the fight against fraud, waste, and abuse work closely with the state Medicaid agency, SMA, to share information about providers and beneficiaries who are exhibiting behaviors suggestive of fraud, waste, or abuse. The SMA will have or will coordinate with a unit dedicated to protecting the integrity of the Medicaid program. It is important to report suspicious behavior to the SMA, even if the specific transaction is paid for with cash or private insurance, rather than Medicare program dollars. Sometimes, such transactions are simply part of a larger pattern of behavior that does involve Medicaid fraud, waste, or abuse. Some situations may require immediate reporting of the suspected fraud, waste, or abuse to law enforcement, as well as the SMA, such as when patient safety is at risk, evidence may be destroyed, or monetary loss may be material. Depending on the nature of the suspicious behavior of a beneficiary or a provider, the SMA may also find it appropriate to take additional action, such as administrative recovery of Medicaid funds or referral to law enforcement for civil or criminal prosecution. To assist the SMA in doing its job, it is important that the report of suspicious behavior includes certain basic information. Information should include the name and contact information for the suspected violator, beneficiary, or provider, contact information for any witnesses, contact information for the pharmacy employee who is making the report, the nature of the prescription or other transaction, and the nature of the suspected violation. The pharmacy employee should inform the SMA of any notes of conversations with beneficiaries, providers, or witnesses, and these notes should be retained in case they are needed later. The key is to document, document, document. If you do not have contact information for your SMA on hand, visit the Centers for Medicare and Medicaid Services, CMS, website to find information on how to report fraud in most states. This link provides telephone numbers and website addresses for reporting suspected fraud and abuse to SMAs and Medicaid fraud control units. Depending on the circumstances, other agencies may also be involved in reporting drug diversion and fraudulent activities. These agencies include a local fraud alert network, the DEA, Health and Human Services OIG, the State Medicaid Fraud Control Unit, the State Licensing Board if a healthcare professional is involved. We have talked a lot about drug diversion, how to detect it, and where to report it. What can pharmacists do to prevent drug diversion from happening in the first place? Several strategies can be employed. One of the detection strategies discussed earlier in this presentation can also be used to prevent drug diversion. Questioning anything that sends up a red flag can be a great prevention strategy. If your pharmacy has a reputation of verifying prescriptions with the prescriber, this may discourage individuals who are participating in drug diversion activities from seeking services at your pharmacy. Pharmacists may be able to discourage drug-seeking individuals by doing something as simple as putting up a poster from local, federal, or state civil agencies or law enforcement to show that perpetrating fraud against Medicaid and drug diversion activity are violations of the law and will be reported. It can also be helpful to display posters regarding the consequences of dealing in drugs illegally or robbing a pharmacy to obtain controlled substances. Your SMA may have developed a lock-in program to help prevent diversion of prescription drugs by Medicaid patients. If a beneficiary is abusing prescription drugs and meets the program's criteria, the SMA may require the beneficiary to obtain his or her medications from a designated provider and pharmacy. This is intended to prevent the beneficiary from engaging in doctor shopping. One of the best things we can do as pharmacists outside of these other programs and strategies is to document. Every encounter that you have with a provider, especially when drug diversion or a fraudulent prescription is suspected, should be documented in detail. Write it on the prescription hard copy. Document it in the patient record. Keep a notebook or file system, whatever you need to do to protect yourself, the provider, and the patient. If you are taking a prescription over the phone, document who you talked to and the date and time the call was received. You can never document too much information. Other strategies, such as avoiding provider identity theft, having a prescription drug disposal program, using a PDMP, and developing a comprehensive training program, are discussed on the next few slides. Prescribers are commonly victims of identity theft. However, pharmacists can use several strategies to recognize when this deception is occurring. Tamper-resistant prescription pads have been required by the federal government for all Medicaid prescriptions since October 1, 2007. Full implementation of the law was on October 1, 2008. A tamper-resistant prescription is required to have one or more industry-recognized features designed to prevent unauthorized copying of a completed or blank prescription form, one or more industry-recognized features designed to prevent the erasure or modification of information written on the prescription by the prescriber, and one or more industry-recognized features designed to prevent the use of counterfeit prescription forms. Prescriptions missing required information, such as a DEA number or NPI, if required to be present by law, should be verified with the prescriber. If a patient is exhibiting drug-seeking behavior when he or she presents the prescription to the pharmacy, the prescription should be verified with the prescriber. Pharmacists have a role in preventing provider identity theft. Many local law enforcement agencies provide alerts to pharmacies and other healthcare entities when a prescription pad has been stolen. All pharmacy personnel should be notified when an alert is received, and, if possible, a notation should be made in the prescriber's record within the pharmacy computer system so that all prescriptions are verified prior to dispensing. Prescribers may change their mind or misspell something on a prescription. If any information on a prescription has been altered, especially a prescription for a medication that's frequently abused or diverted, this information should be verified with the provider. Many prescribers call in prescriptions for their patients. Prescriptions that are called into the general pharmacy phone number and not the dedicated prescriber line should be received with caution. Requesting a DEA number, an NPI, a state license number, an office address, a callback number, or detailed patient information may prompt you to verify the prescription with the provider after disconnecting. A prescriber may hesitate to provide detailed patient information other than a name and birth date, while an imposter may hesitate or hang up when asked to provide an NPI or state license number. Be sure to document as much of the encounter as possible, and do not forget to write down the name of the person to whom you spoke. Further information regarding the importance of provider identity theft prevention is included in the Safeguarding Your Medical Identity Toolkit on the CMS website. The need to properly dispose of unused prescription medication is evidenced by the fact that the abuse of prescription drugs is the fastest growing drug problem in the United States, and most of the abused drugs are obtained through family or friends. According to SAMHSA, substance abuse treatment admissions involving the abuse of prescription pain relievers rose by more than 400% from 1998 to 2008. Reducing prescription drug abuse is a top priority identified in the 2010 National Drug Control Strategy. Campaigns such as Dispose My Meds, coordinated by the National Community Pharmacists Association, provide education on proper medication disposal. Advantages to providing a prescription drug disposal program include deterring drug abuse by decreasing prescription drug availability, deciding on the most effective and proper method of drug disposal, disposing of drugs properly to protect the environment, and disposing of drugs to decrease the potential for accidental ingestions. As pharmacists, especially those in community practice, it is important to know where patients can go in your community to appropriately dispose of their medications. Referring patients to local programs for safe medication disposal can help keep unused medications from being disposed of inappropriately and from being diverted. If your community does not have a prescription drug disposal program, you can work with local advocacy groups to create one. The DEA has also been coordinating national prescription drug take-back days since 2010. This program is a result of the Secure and Responsible Drug Disposal Act of 2010. In the 4 events that have been held between the fall of 2010 and fall of 2013, in excess of 3.4 million pounds, or 1,733 tons of drugs have been collected. A PDMP is a state electronic database that collects designated information on substances dispensed in a state and provides data access to doctors, police, and other authorized users. A PDMP can be used to detect doctor shoppers and drug seekers. As of July 2013, 49 states have enacted legislation and 47 states had operational PDMPs. What are the benefits of a PDMP? A PDMP provides data that identifies a patient's use of controlled substances, informs providers about patient medication histories, and identifies instances of possible doctor shopping and drug-seeking activity, assists prescribers in deciding when to refer individuals for treatment, provides information that may support the provider's decision to refuse prescribing narcotics to a patient with no medical evidence of need, and provides documentation that can be reported to law enforcement. Provides reporting to analyze outlier prescription histories, and provides prescription information to determine drug use and abuse trends. PDMP requirements vary by state. Some require Schedule 2, 3, and 4 substances to be monitored. Other states also require Schedule 5 substances to be monitored. Some states also allow non-controlled substances to be monitored. Depending on the state, the program is established by the Department of Health and Human Services, a state authority on drugs and alcohol, or the Board of Pharmacy. The National Alliance for Model State Drug Laws provides a forum for state and federal agencies to share information on prescription monitoring programs. The Alliance supports the establishment, operation, and enhancement of PDMPs, enhances drug abuse intervention and prevention programs through information exchange, and develops guidance documents with the goal of creating exemplary and fiscally responsible drug and alcohol strategies and legislation. The last prevention strategy we're going to talk about today is implementing a comprehensive training program. A comprehensive training program is designed to provide education on how to recognize, prevent, and report drug-seeking activity and prescription drug fraud. Incorporating a training program into your practice can provide several benefits. Benefits of a comprehensive training program include improving compliance with federal and state regulatory requirements, which include documentation requirements for controlled substances, state laws regarding storage of controlled substances, and state laws regarding filing of prescription records. Promoting adherence to internal policies to review and audit prescription claims data. Increasing collaboration with other providers to recognize, prevent, and report drug-seeking activity and prevent drug fraud. Enhancing coordination of prevention strategies, monitoring, and use of data systems. And increasing the referral of cases to the appropriate agency and support of law enforcement. Know what to report and where to report it, and if a Medicaid patient is involved, the SMA should be notified. A comprehensive training program can be part of a compliance plan. This will be discussed in more detail in the next section of this presentation. In 2011, CMS performed audits of a number of Medicare prescription drug plans. These audits resulted in significant findings related to risk assessments and appropriate monitoring. CMS found that risk assessments were lacking for each of 5 operational areas, including Part D formulary administration, Part D coverage determinations and appeals, Part D grievances, Part C and D agent and broker oversight, and Part C and D compliance program effectiveness. To be effective in preventing drug diversion, pharmacies should assess the risks arising from pharmacy operations. Pharmacies should identify the specific risk factors that affect the likelihood that a prescription filled at the pharmacy will be diverted. For example, what is the level of controlled substance inventory maintained at the pharmacy? Is the pharmacy operation located close to any provider office, such as a pain clinic, that has been identified by the SMA or law enforcement as a suspected source of fraudulent prescriptions for controlled substances? Are areas adjacent to the pharmacy operation, such as a parking lot, frequented by persons who appear to be conducting business there? What identification does the pharmacy require from persons who are seeking to fill a prescription for a controlled substance? Does the pharmacy operation use closed-circuit surveillance of persons who are entering the pharmacy or the drive-through area? To prevent drug diversion, pharmacies should also perform random periodic audits of drugs on hand to detect discrepancies in inventory or billing that may be indicators of drug diversion, as well as verification with customers that the prescribed medication and quantity were dispensed. Pharmacy employees should be required to use the PDMP if available. Finally, pharmacies should analyze prescription data to detect patterns that may indicate fraud or abuse, such as prescribing drugs of abuse for family members, writing an unusually high number of prescriptions, and writing prescriptions for unusually high doses. Many resources are available to help combat drug diversion, fraud, waste, and abuse in the healthcare system. Information can be found on the websites of the agencies and organizations provided on this slide. This presentation was current at the time it was published or uploaded onto the web. Medicaid and Medicare policies change frequently, so links to the source documents have been provided within the document for your reference. This presentation was prepared as a service to the public and is not intended to grant rights or impose obligations. This presentation may contain references or links to statutes, regulations, or other policy materials. The information provided is only intended to be a general summary. Use of this material is voluntary. Inclusion of a link does not constitute CMS endorsement of the material. We encourage readers to review the specific statutes, regulations, and other interpretive materials for a full and accurate statement of their contents. Thank you for viewing this presentation. This presentation was provided by Strategic Health Solutions, LLC, as the Education Medicaid Integrity Contractor in conjunction with the Centers for Medicare and Medicaid Services. For any questions, comments, or concerns, please submit an email to the address provided.